we have Dr. Evanilda Souza de Santano Cavallo, and she has a PhD in nursing and holds a postgraduate degree in nursing and collective health. She currently teaches in nursing undergraduate courses and works in the area of nursing and adult and elderly health and collective health nursing in Brazil. Her study focuses on chronic illnesses and stigma and health in vulnerable groups. Thank you so much, and welcome again. Now I'll turn it over.
Hello, everyone, and hi, Yvonne, and thank
Hello.
you, Coretta Generate, for my invitation. And sorry because my English is not good, but I will try to explain about our research and that involved 25 persons from Bahia-Brazil, and that have sickle cell disease. And in our interest, it's investigate about discriminations, attitudes from professionals and the families and parents and the physicians and nurses and toward people with sickle cell when they search health services for achieve care for the pain. In general, the people respond that discrimination is more intensive in emergency homes and in workplace and scholar places. Can you understand what I say?
Yes, we can understand you.
And 1 minute I will explain about the localization of study, because in Bahia, in Brazil, it's situated in a coast of a country that in the colonization in the period that the people the human traffic of people from Africa to Brazil start in this place. Salvador is capital, the Bahia now, and the Salvador is the first place and to receive people from Africa. And because it's Bahia have the more population, the Black population, the African population, and the residents in here. Despite Bahia be the state in Brazil that have more people with sickle cell disease, in this state, discrimination toward the racism and the stigma and toward people with sickle cell is so high, and it's necessary, and the prevention actions and our interest like a nurse is know the characteristics of stigma in Bahia for and decide to plan attitudes and the actions and the projects to enforce people and the empowerment to, how can I say, fight, prevent these situations, especially with healthy professionals. And in these cases, we apply interview in profundity with 25 persons that have sickle cell disease. And after that, we codificate and categorize the different steps, the narratives from people with sickle cell, and for understand and the characteristics of the stigmas in these places. And we organize and they publish in one article, one manuscript in a journal that you can, and I recommend that the people interested in these thematics can read again or after. And because the characteristic of discrimination toward people with sickle cell, it's more and reveal more curiosity for us. Now we working on project that education and qualification of health professionals to avoid and prevent stigma in emergency rooms. And we categorize in three parts, in three categories, and the interactions with family members, interactions with the general public, interactions with healthcare workers. In each group, we explain the characteristics that interactions with stigmas is present, and it's different. For example, interactions with family members, the label that the people receive is that one person with sickle cell disease is unable, unless unmotivated, overwhelmed, and the complaint. It's like it's family believe that the people with sickle cell disease complain about pain more time. It's like it's discredit about narratives about pain, that intensity of pain is like they are lazy, they can't don't like to collaborate with house work, or collaborate with financial, or collaborate in one employment. That is more complicated because they feel unconsidered and unrespected for for their families. In the interaction of the general public, the people apply label of complainant, the lazy, get soft at work, the sick, and the unable. In the interactions with health care workers and the workers and the, how can I say, and apply one responsibilization for people that for their sick. It's like guilty of not get better. Can you understand it?
Yes.
It's like one judgment. It's if you can't be better, it's because you don't like to do it. It's more or less that. And it's classified like addicted to drugs and the sexual deviant when the teenagers and the young men, black men, entry in an emergency room with priapism. And the other characteristics about stigmas is a stereotype. With family, the stereotype more common is trouble. And the general public, the stereotype is weak and sick. In with interactions with health workers, the stereotype is loopy, addicted, and immoral. The discredit it's unconsidered the narratives about pain. It's more common in situations of pain and fatigue inside the family. And the same discredits happen in the public situations in the emergency rooms too. It's like the people, we perceive that racism apply one different prejudice within one pain. The people suffer, it's the acute pain or chronic pain. If it's chronic pain, they are accused to be lazy. If it is acute pain, they is accused to be drug diggers. We find in our research that the people adopt one distance from people with sickle cell disease. In general, the family members and judge the people is incapable and lazy and incapable to be a hard work. In public in general, the colleagues and the partnerships and the co-workers judge the people is lazy, can't collaborate with work. Interaction with healthy works, the people judge the person with sickle cell disease is normal and no collaborate because don't like. What we find in this study about sickle cell disease and the stigma in pain situations, what's happening are consequences, immediate consequences, and the consequences to later is the people, the public in general, adopted one disadvantages to people with sickle cell disease and start one job or maintain one employment. In the adopted distance in the boroughs, because the general people believe that the I can say the color, the yellow color in eyes in English. I forgot the words. It's like the bilirubin presence in the vision, the eyes jumps. Yes, they believe the people in general that is ignore what's the sickle cell disease, believe that it's necessary adopt one distance of bodies with people with sickle cell because they believe that it's infection and transmitted by contact. And they adopt one isolation. And the healthy workers, the people delay services and the discontinued treatment and attendance with less professional, with less qualified professionals. That's more complicated, but we intend now it's producing more and more projects to qualify professionals to understand what is sickle cell disease and understand the complications of people and adopt one attitude more welcoming with people in emergency zone. Oh, I believe that I spend my all time. Let me know if I have more time.
You can keep going until
Uh,
they tell you otherwise.
So can you just tell me a little bit about the healthcare system in
Brazil,
Brazil? Yeah.
yes. In Brazil, we have one unity health system that it's and the support from financial from federal and government. This system, every people that stay in the country, independent to be immigrant or in transit or live in Brazil, have rights to be attended their necessities in the universal health system. In specific for people with sickle cell disease, this system and support the blood transfusions, hydroxyurea, surgeries, and the attendance in emergency rooms. Because the people with sickle cell disease in my country will be more poorest people, they count only with health system unit that is public and is free for everybody. But this system has one complementary system that is private. What's happening? If the health system and the public rooms and the public units couldn't be one surgery, one treatment, the population have opportunity to entry in the private system to complete treatment. But it is more complex and spend more time. And sometimes the people spend more time in and wait for one specific treatment, and they died wait about. What is positive? It's the all people, for example, the mothers that have children with sickle cell disease receive and the prevention about brain attacks, and they use blood cells transfusion every month, receive it from public health. It's out payment for. And that is more important, is the penicillin, the vaccinations, every medications and specific vaccines, and the nutrition consults, nursing consults, in the pediatricians and the hematologists, it's offered for health system unit. We have more problems. What is negative? It's when the policies create these one policies for a specific population, the government no create together one part of financiation for actions, for sustainable actions for all people, and that's produce more inequality. But in the another hand, more universities in Brazil engaged in researchers, essentially for nurses, researchers, to dedicate one time for these people and for advocate about more rights and more services to attend the necessities.
Thank you. Thank you so much for this talk. We appreciate you, and we know that, you know, trying technology over the
Thank you,
over different
Yvonne.
countries.
Thank you, Corey.
We have time for maybe one or two questions. Do we have any questions?
Oh, I would like to know what the government from United States have a specific policy for people with sickle cell. That's have one plan, all states in the United States to attend specific necessities for people. Let me understand you one little bit about.
So for policies, it differs from state to state. And so we have a lot of different policies. We have the federal overall, but every state has different policies, and every city has different policies. And then like, I'm sure there, every hospital has different policies. So you can go from one state to the next state and it's completely different, or one hospital to another hospital. Yeah, so it's
Oh, I understand, because it's produced, for example, the people, it's common the people in the United States migrate to one state for others for 5 year services.
I'm sorry, could you say that again?
And I perceive one time that I stay in the United States that many people move from one state for others.
Yeah, and some
That is,
people
that is
people
because
move.
different services.
Right, and so some people will move to other states to get better care. Like if one state doesn't have, for instance, a large sickle cell center, some people might move to a state or city where there's a large sickle cell center to get better care. So
Okay.
yeah.
I look for one example in the United States that I think, oh my goodness, one day perhaps I can do it in here. That says the promotion the teenagers and the camp. The camps with for people with sickle cell in Texas, it's so amazing. And I
Yeah,
am more motivated to know more, because in here, the physical educations and the professors and the teachers, it's heavy afraid to engage teenagers in physical exercise, because they think that it will be more complicated because it have sickle cell disease. And I feel, I can say, I haven't invite.
well, unfortunately, a lot of the camps, because of COVID, they haven't had camps the past couple of years. I think some of them might be starting back, but yeah, that's one of the big things that we haven't had. So yeah, the children have suffered because of that.
In COVID time, we suspend a lot of services, and the more people suffering with more complication too in here. I forget to say that in here, the health system approved one policy to people find blood transplant for cure of sickle cell disease. It's paid from federal government. That is result the fight for rights from movements, the Black people in here.
Okay, well, I thank you so much for your time, and we really appreciate you and all the work you're doing.
Thank you so much. And I say more one time that sorry, because I didn't study in English now, and my pronunciation is terrible.
You do not have to apologize. We give each other grace. That's what we're here for. You know,
perhaps I can be better if I visit you.
You're doing incredible work. So thank you so much.
Thank you. Have a great time. Thank you, Corita.
You too. Bye-bye.
Bye.